Or it could be some patients actually who are grinders, maybe they are experiencing some sort of a crack. The moment you see like it splay out like a flower, that's also a sign that you have to change the toothbrush. Okay, for tooth sensitivity, there's actually quite a number of factors. Be it maybe you're having like gum recession, then the roots are exposed. Therefore, whenever there's any external stimuli, when you eat, when you drink, then you feel sensitive. Or it could be maybe there's a decay. Or it could be some patients actually who are grinders, who love to eat a lot of hard food, maybe they are experiencing some sort of a crack. So as long as if you're having this on and off little bit of sensitivity, then I think you can be rest assured, maybe you just monitor a few more weeks. But if the sensitivity gets more and more intense each time it comes, or the frequency increases, then you may want to check it out to your nearest dentist. Usually, for toothbrushes, of course, I think many of us have heard about it, that we always must change every 6 months and stuff. However, if you actually don't brush that hard, the bristles are actually quite long lasting. You may not necessarily have to stick to that every 6 months, 3 months kind of interval. What I usually do, I always look at my bristles, okay? The moment it starts to go past like a certain mark, let's say like away from the brush, all right, then you may notice that, oh, actually it's fraying a lot, all right? And at this kind of angle, you may actually want to consider to change out already. Secondly, some of the toothbrush that we buy out there, maybe they have a lot of different styles and stuff, like maybe crisscross action and whatever. That one may be a little bit harder to tell, but the moment you see like it splay out like a flower, that's also a sign that you have to change the toothbrush. Some of us, maybe we will hang our toothbrush in like those enclosed covers. That one, just take note as well that you need to clean the covers as much as possible, because every time after you click close and then it lasts the whole day before the end of the day, and then you open up and brush again, there are chances are you will have a lot of bacteria or maybe even fungus growing inside the cover itself. So all this you have to clean. Either that, or you can also just leave it out in the air to dry. All right, but whenever you put your toothbrush, always make sure it's not too close to the toilet bowl where aerosols, when you flush, it will actually get caught on the toothbrushes as well. Yeah, so these are small things that you can take note of. Okay, another very common question. So usually for toothbrush, of course nowadays there are two types, the electric one and the manual, the normal one, all right? So I think most of us will use the normal manual one. So I usually look out for three things. This is just my personal opinion. So for the three things that I look out for, firstly, the toothbrush size cannot be too big, all right? Roughly about the size of 2 teeth. So maybe you just rough gauge, okay, roughly 2 teeth, all right, the width. So this is a bit too long for me. So definitely this size is not suitable, all right? Doesn't mean that the longer head, you can brush more surface, means it's actually better. Because especially when you brush towards the back, your mouth is not big enough to accommodate such a big brush. So always choose the right size. Second thing that we need to do is to check the bristles, all right? So nowadays we always go for soft because we do have a lot of people scrubbing really hard, and then your gums shrink a lot more than usual. So bristles must always choose soft, not medium, not hard. And then the last thing that I usually look out for is the type of bristle. So the bristles must be very fine and they must be very, very close together. All right, so those brushes that has a lot of gaps, a lot of spaces in between, they may not be so good. All right, so these are the three things I usually look out for in choosing my toothbrush. Okay, for teeth whitening, generally they have two types. One is the take-home kit where you go back home and do it yourself. And the other one will be the professional whitening at chair side within the dental clinic. So for take-home kit, most of the time the dentist will take a mold, all right, so that you have a customized tray for yourself. And then we'll prescribe you tubes of gel, all right, for you to apply. We teach you how to apply it and how to put it on, clean it and everything. The take-home kit, the good thing is that it's DIY. You can do it at your own leisure. However, you need to do consistently, maybe for a period of 7 to 10 days at least, to actually see the effect. And then maybe after some time, once the effect goes down, you feel that you want to whiten again, and then you can always just use the remaining gel. You can apply again for another week or so. For the chair side, it's more of an immediate effect. So most of the time, we'll come in, maybe sit down, we'll do a discussion, check on what's the original color of your teeth, and then we will see maybe 2 cycles, 3 cycles, or even sometimes up to 4 cycles within an hour to brighten the color of your teeth. Okay, usually those are at a much higher concentration or more acidic in a certain sense, and it's not suitable for take home. However, those effects are immediate and usually last a longer period of time, and usually at a higher number of shades that you can get. So these are the main two types. It really depends on what is your preference. Of course, nowadays there are also the shorter interval kind where it's like an introduction chair side, maybe only about 10 to 15 minutes. You can whiten a lesser amount of shades, but minimal sensitivity. So these are the things that you can consider. Most of the time, I would say the take-home kit, it's less sensitive because of the concentration, but the results may not be optimal. Maybe you need to require you to take longer period of time. But if you want to be hassle-free, you can always just do the chair side, immediate effects you can see. However, you must always maintain at home so that your results can last longer. So a lot of small things like diet, toothbrushing, or your oral hygiene maintenance must always be very, very diligent. Enamel erosion, I would say there are quite a few factors as well. So lifestyle, diet plays a very big part. Some patients, maybe they are grinder, they are clencher, they eat very, very hard food often. So all these will attribute to the wearing down of enamel. So because of that, when the enamel gets thinner and thinner, and then as we chew maybe like hard food and stuff, it's easier for the bacteria's acid to attack the surface and then cause some type of erosion. Some of these becomes a decay, all right? Some of it, if you're able to clean it well, if you brush very, very hard and with that thin enamel, you might actually scrub it off, and therefore you're actually causing a cavity by yourself. So there are two types of cavity whereby one is caused by the bacteria and one is actually non-bacteria related. Could be your diet, could be your brushing. So I would say for erosion, sometimes if you are worried, you may want to check with a dentist first to see what are your possible risks, whether is it coming from your toothbrushing, whether it's coming from your diet, or whether it is actually just your oral hygiene that's playing a big part of it. Okay, yes, there are way too many brands of toothpaste out there. It is very, very hard to choose the exact one that you want. What I do, I only recommend toothpaste with fluoride. The reason is because fluoride is very well researched to reduce the risk of decay, and of course it helps to promote or rather reduce the sensitivity. So for most of our toothpaste, the boxes under the ingredient section, you may notice that they have this ingredient called sodium fluoride. Then they usually have a bracket, how much ppm concentration. And you should always make sure that they have at least 1000 ppm. So they actually helps you to reduce your risk of decay. Or for those toothpaste with like charcoal or like all natural, no fluoride kind of ingredient, I think if you are somebody who is high risk of decay, like you have multiple cavities, fillings done before or crowns done before, those options are maybe not so good for you because they don't actually help you in your day-to-day oral hygiene maintenance because you are already at a higher risk. So I would say if let's say in general, you can choose the fluoride or the non-fluoride, but if you are already somebody who has multiple things done in the mouth, you may want to choose a fluoride option. For whitening toothpaste, most of the time, they probably only work for a very, very short amount. They are mostly using abrasive. So when you really scrub hard, the abrasive will actually remove the superficial stains and stuff. You may notice that there's that little difference immediately after you brush. But in the long run, this abrasive, if you scrub too hard, then you're actually also removing the enamel while you're scrubbing. So whitening toothpaste, most of the time, I don't recommend you to use for long term. Maybe every now and then you have a certain event, you can always just buy the whitening toothpaste to like help you to remove certain stains that you are a bit harder to remove. Okay, common problems I see, let me think. For example, maybe like somebody who is on the younger spectrum, maybe likes to drink coffee, a smoker as well, right? So their concerns are usually yellow teeth and they have a lot of stains. So most of the time I would actually advise, because for them, their mouth are usually dehydrated because they drink coffee, and then after that, maybe at the same time they drink, they smoke as well. So in that case, the mouth is very dehydrated, the teeth is dry, it's easier to catch stains, maybe the plaque tends to stay there a bit longer, and therefore, all this discoloration will happen. So most of the time for them, I focus a lot on diet and lifestyle first. Of course, telling them maybe if you like to drink coffee, always drink some water after that. Or if let's say you drink iced coffee, then always use a straw so that it bypasses the front teeth, like on the outer surface, not so much, right? And if let's say they smoke, of course, best is to cut it off, cessation. But if let's say really very hard, then try to reduce. So as time goes by, I will check in with them, how are you coping? Are you able to cut down, that kind of thing. So that's one part. And then the second part, usually I will advise you need to brush more frequently. Maybe during your lunchtime, if you're worried, you can always, after a meal, wait for about 15 to 20 minutes, and then after you go and do a brushing and cleaning, if you're worried about the stains. So the other option, you can always make sure that you add in all the extra precaution. Let's say after brushing, you do your flossing, remove all the plaque in between your teeth. And then also you can use mouthwash, all right? Maybe it can help you to cleanse your breath, reduce the bacterial load in your mouth, so that maybe not so easy to catch stains as well. So these are the more general tips. For maybe another type of patient, the older folks, maybe they are in their 50s, 60s, and that's when also they start to experience a lot of dental problems. Most of the time, what I usually see for this bunch of people, usually they are experiencing decay or maybe cracked teeth. All right, and then they will always be like, oh, doctor, I chipped off my tooth after eating. How come? So a lot of times, because we only have one set of teeth, all right, so it depends on how well you use it. I always give an example whereby you only have one set of wheels. If you run on rough roads every day, your tires will wear off, and eventually you have to change out your tires. But for teeth, you don't have another set. So the only other way is maybe for crowning, maybe you have to remove, do an implant, change to a denture. So for these people, most of their problems are usually related to hygiene or their lifestyle with regards to biting on chicken bones, they like to chew cartilages. So for them, I usually advise cut down all this. Maybe don't cut out 100%, but reduce the amount. And then always cut food into smaller pieces, maybe sliced beef rather than a huge chunk, so that you use less force to chew. All right, and then it will help to prevent some sort of crack that could happen. Yeah, so most of the time, when you have cracked teeth, when you have broken teeth, I would say, likely you will need a lot of dental treatment. Let's say maybe you need a root canal, and then after that you need a crown. So prevention is always better than cure. So all these things play a small part on a day-to-day basis. So don't wait until only when you have a problem and then you see us, and then after you'll be telling us, oh no, how come this happened, and then now I have to spend so much money to do all this treatment. So I would say these are the two bigger types of patient that I would see on a day-to-day basis, and this is what I would recommend.